Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Hip replacement surgery, one of the most common joint replacement procedures in the country. As a matter of fact, between 200,000 and 300,000 hip replacement surgeries are performed each year in the U.S., and the numbers continue to grow. Dr. David Miller is an orthopedic surgeon with Orthovirginia. He's here now to talk about a less invasive approach to the procedure. Okay, first question, what is direct anterior hip replacement?
Direct anterior hip replacement is when we do the incision up through the front. Traditionally it was done through the back, and it is less invasive in that it's muscle sparing, a smaller incision. However, the real reason I think that this is beneficial to the patients is we're not operating through the muscles that we tend to walk with.
And the question is, who's the best candidate? Is it just for anybody?
Traditionally, I mean, usually the smaller patients, but now I've grown my practice to just about everybody can get their hip done through a direct anterior approach.
Is it painful? Is this surgery different than the others?
It's generally less painful. Patients tend to get up quicker. It's more stable. At a year out, it probably doesn't matter. You know, hip replacement is the best procedure we do in orthopedics. So patients do like the fact that they can get up going quicker and it's more stable for them.
You kind of read my mind, because I was going to say, does it make the recovery any easier for folks?
Yeah, they have no hip precautions. Basically, they have their surgery that day, they're up that day, and as soon as they're up and downstairs, they go home, which is in a day or two.
Okay, wait a minute now. They have their surgery that day and they're back up that day?
Yes, they do. Yes, they do. Yep.
That is impressive.
Yeah, yeah.
This is life-changing stuff. Talk about that. I mean, it really changes the way people can get around.
Absolutely. I mean, people, you know, we don't have the same feelings our grandparents did, in that we want to be able to get up and keep active. You know, we're not going to be sitting around, laying around, and we just got to move. So it's a big deal for patients, absolutely.
You see it every day, huh?
I do.
So if people want to get involved, what can they do?
They can call the office and set up, and we'll have a look and see what's going on, and if hip replacement is an option for them, then I think the direct anterior hip replacement is the way to go.
All right, that is Dr. David Miller. Thanks so much for joining us today.